Regular chemotherapy is limited by damage to the bone marrow, and if we can give larger doses of chemotherapy and replace the bone marrow with stem cells or bone marrow from a donor, that allows us to cure more patients with hematological cancers. Bone marrow transplant does not involve any surgery. We put the stem cells down an intravenous cannula into the bloodstream, and either the bone marrow or the stem cells find their own way back to the patient's bone marrow through the patient's own circulation. So no surgery is involved. It's a bit like having a blood transfusion. Some patients have cure rates of greater than 80%. Donation is a relatively simple procedure. We collect blood cells from the patient's arm. It's all done as an outpatient, and it's very safe. Success of transplant has improved immeasurably over the last 10 to 15 years. That partly relates to a better environment for looking after patients, but it's also about doing transplants in a smarter way with less toxic treatment and more targeted therapy. And this allows us to treat many more patients safely with better long-term outcomes. All of the doctors and nurses involved in the treatment and care of those patients are specifically trained to look after high dependency patients. The transplant unit at HCA UK at University College Hospital is the only university-based private transplant unit in the UK. Units are accredited by JC, which is a European-wide accreditation system. We are accredited both as a transplant centre to treat patients and also as a centre to collect stem cells.